In this short narrated PowerPoint presentation, you will be introduced to how nurses make clinical decisions, including, toward the end, some comments about making clinical decisions in emergency situations. Although I'll use the term clinical reasoning, I recognize other interchangeable terms for that. Critical thinking, problem solving, decision making, clinical judgment, nursing judgment, all hashtags for clinical reasoning. I will be citing two wonderfully written articles that have informed this presentation. The first is The 5 Rights of Clinical Reasoning, an educational model to enhance nursing students' ability to identify and manage clinically at-risk patients, and Thinking Like a Nurse, a research-based model of clinical judgment in nursing. Clinical reasoning in nursing includes making judgments based on alternatives, evidence, pattern recognition, and intuition to come to a decision. From the 5 Rights of Clinical Reasoning article, I quote, "We use the term clinical reasoning to define a logical process by which nurses and other clinicians collect cues, process the information, come to an understanding of a patient problem or situation, plan and implement interventions, evaluate outcomes, and reflect on and learn from the process." Does that sound familiar? Well, it should. It's the nursing process. The nursing process is the nurse's basic framework for thinking and decision making. It consists of 5 to 6 steps. First, you gather data. Then you analyze that data to assign a nursing diagnosis. Then you formulate outcomes or goals, plan the care, implement the care, and evaluate to make sure you've met the goals. Some sources put planning and implementation together as one step. Since clinical reasoning involves making judgments, let's look at how you make judgments that lead to decisions in something you can easily relate to. What clothes to wear? What food to eat? Where do I need to go? Okay, so choosing one of those questions, how do you decide what to wear when you get dressed for the day? Well, first of all, you might check the weather forecast and the temperature. You might think about what you'll be doing and where you'll be going. You might decide what to wear based on a comfortable fit, if you're traveling especially. And your job may make the decision for you if you have to wear a uniform. What resources informed your decision? Well, decisions are based on getting input or data from various sources. These sources inform our decision. As you ask questions, you're gathering data that will inform your decision on what you will wear. Well, we requested data from the weather app on my phone. I consulted the schedule to see where I would be going today, what I would be doing. And then I thought about, how do I feel? Do I feel bloated, like this kitty cat here? Do I need a loose clothing today? Or look at the policy rules of the workplace. Is it business casual or business formal today for a meeting? There are other things that may influence our decisions. Previous experiences influence our decisions. Friends and family's experiences or their opinions might influence our decisions. Our culture will certainly influence our decisions. Coworkers, media, and thought patterns, they all contribute to influence on our decisions. Keep that in mind. Okay, let's put our sample into the nursing process. All right. So we gathered data, we looked at our weather app, we looked at our schedule, we thought about our feelings, etc., etc. We analyzed that data. I'm working today, so I will wear my uniform with short sleeves because it's going to be hot out. And I formulated a goal. Well, I'm going to get dressed in my uniform to get to work on time. I planned ahead. I will make sure I have a clean, pressed uniform the night before. And then I implemented that plan. I'm dressed for work and ready to go on time. And then I evaluated the results. Do I look okay according to the dress code? Okay, let's get back to clinical reasoning. What resources inform a nurse's judgments? Well, first of all, there's the standards of practice. The American Nurses Association prints the standards of nursing practice. Care provider orders. Patient condition. Patient preferences. Okay, so the first step in making a clinical decision is to gather data. This is done through physical assessment, talking to the patient, looking at the electronic health record, a report from outgoing staff, and knowledge of the diagnosis. Okay, the next logical step is to consider all the data together, like investigating evidence at a crime scene, or putting the pieces of a puzzle together. Creating mind maps may assist data analysis. Here we have subjective and objective data that we then analyze, expressing our analysis in a nursing diagnosis. Mrs. B has pneumonia. Here I have subjective data. She says she can't sleep, her chest hurts, it's hard to breathe. The objective data are her saturations, her vital signs, and use of accessory muscles and her pain score. And then in analyzing that data, I've chosen some nursing diagnoses here. Impaired gas exchange, ineffective breathing pattern, ineffective airway clearance, altered sleep pattern, and altered comfort, pain. There's much more to doing a nursing diagnosis for a student nurse. They have to fill out a lot more spaces. However, we're just getting started with this. So creating a mind map helps you to sketch that out. A very important step not to be neglected is formulating outcomes or goals. What do you want to happen, or what do you want the final outcome to be? Well, the SMART format might be helpful in making SMART goals. That's to be specific, measurable, achievable, relevant, and timed. Here are patient-centered goals for Mrs. B. I want oxygen saturation to be 95% on room air within 72 hours. I want her to demonstrate effective cough after teaching session, to demonstrate controlled breathing after teaching session, to use controlled breathing 3 times today before meals, report that she is feeling rested after sleep within 48 hours, and that the pain will be reported at less than 2 on a 0 to 10 scale 45 minutes after taking medication. Okay, now that we're confident in our data analysis and goals, we can now plan the care. Planning the care is team-centered and requires attention to care provider orders as well as nursing orders. Okay, now we're ready to carry out the planned care and meet the goals. We must do the work. What is the RN responsibility? What are the care team roles? Don't forget patient and family. They might have a role as well. Okay, was the nursing process successful? Did it work for the patient? Let's evaluate. Look at the outcomes and compare to the current state. Oxygen saturation 95% on room air within 72 hours. Mrs. B demonstrated effective cough after the teaching session. Mrs. B demonstrated controlled breathing after the teaching session, and she reported that she felt rested after sleep within 48 hours. Her pain was reported to be less than or equal to 2 on a 0 to 10 scale 45 minutes after taking the pain medication. Does anything need to be changed? Yeah, we just changed the 2 points in that she already demonstrated controlled breathing, so now we're going to encourage controlled breathing 3 times a day. And we're also going to encourage effective coughing prior to meals. Now here's the part about emergent decisions in critical situations. Failure to rescue is a very important concept for all nurses to study. Failure to rescue someone may result in severe harm or even death. That's why data gathering through assessments is so important and ongoing. And then ongoing analysis of that data is crucial to recognize decline in a patient's status and respond to that. You can get a thorough look at this concept of failure to rescue in the book that I wrote. In this book, I asked 2 questions. What is the worst thing that can happen with this patient with a high probability? And then what will I do as the responsible nurse to respond to what that worst thing is? There is a 3rd question, but you can buy the book to find out. These questions help students and nurses to prepare for a clinical shift. You can find a narrated PowerPoint presentation actually on this method of my teaching at my YouTube channel, Prof. Clay A+ Clinicals. That'll be on the next slide. Okay, this is the end of this presentation. I hope you enjoyed it and learned something from it, and I hope it whets your appetite to study more about clinical reasoning. You can find more narrated PowerPoints on my YouTube channel at Prof. Clay A+ Clinicals.